Hello, I'm Amelia Garibaldi, and this is my presentation on the Helling versus Carey case of 1974. Some background to this case. Patient Helling sought treatment from her ophthalmologist due to eye pain and irritation. She actually did have angle glaucoma, which was rare for her age because she was under 40, but the doctors did not perform the right treatment and they did not come to the right diagnosis in good time. A pressure test is normally administered for this condition for patients over 40 years old, but since Helling was younger than 40, her ophthalmologist did not administer this test. It was later determined by a pressure test that Helling got that she was in fact suffering from glaucoma, and it wasn't just irritation from her contact lenses, and she ended up suffering from permanent eye damage. She lost her entire peripheral vision and a lot of her central vision as well, which is irreversible eye damage. Helling consulted other physicians and eventually filed a complaint against Dr. Thomas Carey and his partner, Dr. Laughlin. The medical issue in this case is the treatment. Helling did not receive a test due to her age. However, this test could have been administered just in case. Um, the medical standard at this time did state that patients over the age of 40 legally required the test, but since Helling was younger than 40, her doctors didn't seem to think that it was important even as a preventative measure. So Helling versus Carey is a medical malpractice case. It's a civil lawsuit that was brought by a patient against a healthcare professional. And in this case, the ophthalmologist um, did not provide her duty of care or his duty of care. Um, so some important terms for this case is duty of care, where doctors have the legal duty to treat patients reasonably as a professional would. So the ophthalmologist in this case did owe the patient a duty to properly examine and do preventative screenings to diagnose her eye problems. Another important term is standard of care, which was a main issue in this case. Um, Doctors are normally judged by what other reasonable doctors would do in the same circumstances, which in this case, most doctors would not have tested for glaucoma since it's very rare for people under the age of 40. However, in this case, the court ruled that um, in this case, a simple quick test, a quick pressure test could have been done because she was losing vision at a rapid pace. And negligence is another important term in this case, um, because the um, doctors did have a duty to provide reasonable care to the patient, and the breach ended up causing harm to the patient. The court's decision ruled in favor of Helling. The ophthalmologist did comply with the standards of the medical profession at the time, but they were held liable anyways. Um, and the court decided that while the medical standard said one thing, all people deserve that same protection. And in this case, the cost of a pressure test was worth it, in comparison to a life-threatening condition or the irreversible eye damage that Helling did end up um, receiving over the years. This decision was really unique because it did go against the standard of care that was set. It was controversial because judges aren't medical experts, and they did end up going against some medical testimony that stated that glaucoma is rare for people under the age of 40 years old, and it's often not tested for people under the age of 40 years old. And also, physicians could then be held liable for um, for care, even if they didn't quite deviate from the accepted standard of care. But people agreed with the court decision, saw that the pressure test was low in cost, it was time efficient, and it was a low risk procedure. So it should have been administered for reasonable care, and it could have just been a preventative measure in the end. So, what went wrong? The provider did not order a low cost and low risk test to check for glaucoma, even though the cost of providing this test was worth it in comparison to the potential medical issues that Helling did end up experiencing. And Helling actually came in for care several times to Carey and Laughlin over the course of many years, and her eye problems were always said to be related to her contact lenses. And after many years, Helling ended up losing a lot of her vision as a result of improper diagnosis and a lack of um, preventative screening. Prevention strategies for this situation. Like I said, routine screening and preventative tests are really important. The pressure test is low in cost and easy to perform and is also low risk for the patient. So it could be used as a preventative test even if the patient is not over the age of 40. Um, Doctors and patients should be interested in follow-ups for symptoms that are not getting better and are persistent, like in this case, Helling's eye irritation and eye pain and vision loss were persistent. So the doctors should have been working on getting a better diagnosis for the issue. And systemic changes, such as providers should be referring to the changing healthcare practices instead of really rigidly following the standard of care, because for different situations, um, a physician may have to go above the duty of care, above the standard of care to come to a conclusion and to give the patient a reasonable diagnosis. The implications for practice. This case showed that the need for reasonable care under the circumstances, um, instead of referring specifically to standard practice, is really important, because things may go missed under just the standard practice. Physicians may be negligent if they don't provide reasonable care. Um, and physicians may have to go past the routine care when the situation warrants it, or they could be held liable. This case also shows the importance of preventative screening. Um, like in this case, the pressure test could have been easily administered to Helling, especially when she came into the office so many times, and it's a low risk and low cost procedure. In conclusion, this case is very unique because the doctors did actually perform the standard medical practice for the situation. However, they did not go above the standard of care and provide um, reasonable care in the form of a pressure test, which caused injury to the patient and led to them being held liable. Um, Physicians can be held accountable for not fully examining a patient, even if it's highly unlikely that the patient would be diagnosed for a certain disease. So, like in this case, Helling was under the age of 40, so it was highly unlikely that she did have glaucoma, but it should have still been covered. Um, and physicians are required to provide a greater duty of care in certain situations, such as this one. And here are my references.